So they told you during your ultrasound that your baby's measuring big. Let's talk about it. We know that ultrasounds for baby's growth is not perfect, but I think there's a couple factors that go into how accurate it can be. Keeping in mind, measurements can be off by 20%, and those measurements are more off when the baby's measuring quite big or quite small, and when you're towards the end of your pregnancy. Factors that influence my thought on this is one, is your due date accurate? And that means, did you know when your last period was, and did you have a first trimester ultrasound? Second, who's doing your ultrasound? If you have someone who doesn't do a lot of growth ultrasounds, their growth ultrasound might be off. But if you have someone, especially who works in like high-risk obstetrics, who does a ton of growth ultrasounds, they tend to be a little bit more spot on. Number three, what has the overall trajectory of your baby's growth been? Were you 50%, 50%, 50%, and now you're 92%? Or have you always been 92, 94, 95, 96%? A trajectory is going to tell me how confident I feel in those measurements. When it comes to the delivery, we don't have any great strong recommendations about when you should be delivered because the data isn't there. What we do know is that having an elective induction at 39 weeks does decrease the risk of C-section, and the thought is because your baby isn't growing any bigger. So if an elective induction falls within your birth preferences, I think it's totally reasonable to do it if you're concerned about your baby's size, but you don't have to.